Good afternoon, everyone. Welcome to another edition of Success Stories. And it's really more than just dyslexia success stories that we talk about, because I'm trained as a developmental neuropsychologist, but also in adult and geriatric neuropsychology. So the clinics at the Morris Center and the teams I work with nowprograms.com, we're focused on all ranges of neurodevelopmental disorders. And today I have the privilege of just talking about predominantly dyslexia from a context of autism, where you might not have language skills or spoken language skills, or you might be struggling with reading skills, but the primary issue is the autism, not a dyslexia that's a genetic dyslexia, but there can be autism plus language disorders. So I have the pleasure to bring on the screen with me today, Aisha, and Aisha is going to talk with me about her son and about
Right.
the growth and the challenges and the struggles. And welcome, Aisha, and thank you for taking the time to talk with us about Abid and his changes and the challenges with autism. Tell us just a little bit of background.
Hi. So Abid is my first born. He was born in 2013. Completely normal pregnancy. He was born full term, 38 weeks, and pretty much was fine. Had a normal upbringing. Was reaching his milestones pretty much within the range. Except like walking, which he did at 15 months, but he was always a little big kid, so it was a little much for him. He was reading at 18 months. He was reading letters, he was reading numbers, he was reading time. And then suddenly, around the age of 2, he basically started getting very like not answering to name calling. Initially, I remember when before the age of 2, I would call his name once and he would like run, whatever, very responsive. Around the age of 2 is when he stopped responding. He stopped trying to talk. He kind of started to get into his own world.
Okay.
Initially, I mean, part of me still is upset about the fact that I didn't take notice of it earlier. It was the time I was doing my residency. So, and my grandmother who was helping me out always told me, oh, boys usually take a little bit longer with language. And so by the time I figured something might be wrong, he was 2.5. We contacted early intervention in Tallahassee. And he received some early intervention OT and speech, but then the speech was stopped because he was because they didn't have the resources. And
Okay.
Abid would get aggressive at times at that age, which looking back, I realized it was not aggressiveness. He was just 2.5. It was more like a behavior,
Mm-hmm.
trying to avoid things, which is something I learned later, that every behavior is a wish to communicate, which we might not understand. And then we moved to Birmingham, Alabama, when Abid was 3, where he was finally completely evaluated. They said that he had autism level 2 diagnosis. He was started on speech and OT and ABA. He was doing about 40 hours a week ABA, plus 1 hour of OT and 1 hour of speech. With 3 years of ABA, I would say he went from someone nonverbal to his first word was push to like saying very basic words, not
Mm-hmm.
much. He still had his behaviors where he was throwing things, smashing things, which actually started to improve once he started to do like a little bit more OT and less ABA. So he was doing about 3 hours of OT a week, plus 2 hours of speech, plus he got enrolled in kindergarten by then. So he started getting some speech and OT at the school. And initially, when he was enrolled in kindergarten, the principal and everyone else was very supportive. They were like, yes, we are going to work with him. We are going to keep pushing him. And the first 2 years, Abid made a little bit of progress. He was happy.
Mm-hmm.
And he was in the special needs classroom. Most of the stuff they were teaching, he already knew, but he was not having any behaviors. When Abid was about to start second grade, my husband and I, we were called in for a meeting because Alabama had this exam procedure where kids have to pass this exam at the end of second grade in order for school to receive funding. And if neurotypical classroom, by then Abid was part of neurotypical classroom, mainstream classroom, and would attend special needs for a little bit of time. But they're we can't have, basically what they said was, we can't take chances with our funding. So they said that Abid will mainly be in special needs classroom on a specified track, which will end up in a vocational track. And they will try to teach him as much as they can. And my husband and I, we don't have anything against vocational track.
Sure.
Our problem was that you stop pushing a kid at second grade. When you stop pushing a kid at second grade, what makes you think he's going to do anything else in high school? You need to keep pushing your kids. And by nature, Abid is slightly lazy. He has to be pushed. So that's when we started to look what's available. And I found this program called Alabama Game Changers. And I went there, I contacted them. We had a conversation with Dr. Denton, the pediatrician on staff there. And she was like, we can start him with sensory integration OT and we'll see where he goes because he needs to be able to sit for a whole exam, a whole evaluation in order to be, knowing what's going on. So we are okay. So they started on sensory integration OT, and Abid improved a lot in that 1 year. That sensory integration really helped him. He stopped hitting his head. He started paying more attention. He started more focusing, and he was doing well. And then after a year, we were told that, they might not have the resources to provide to Abid. At that time, you came in because Alabama Game Changers was part of Morris Center. And we had a meeting, and you suggested that to improve his brain plasticity, he gets 3 or 4 hours of speech sessions a week, plus the OT, and his regular OT will discuss and learn from the sensory integration OT, so with the speech, and would apply those things in treating Abid. And
I'll say, and what we're trying to do is use that, what we call that high intensity, high frequency, and a developmental hierarchy approach, because we know he's learned things, he's made growth in learning, he's capable of learning. The challenge with what we're faced with at that stage is, okay, so some skills have built in sensory processing, but attention comes from some lower level sensory processing skills. The belief is it's part proprioceptive, it's part vestibular, and it's part tactile. So if those 3 systems aren't working really well, you won't have as much attention. And attention precedes cognition, which is learning. And so we're using intensive OT to try to change those inputs into those sensory systems, change how well those systems integrate together to build higher level skills like attention, focus, and shifting of focus, and then also start to work on building those sensory skills needed for language. And language is a sensory integration as well. It's part visual, it's part acoustic, it's part oral tactile, oral kinesthetic, and then it's part cognitive in learning, reasoning, and thinking about those systems. So we look at language as a sensory system, motor system, just like we look at OT as a sensory motor system. So when I got involved with a short term, when we had a short-term Morris Center clinic in Alabama, it was to say, okay, let's take the Morris Center's model and really try to increase the intensity and what we call transdisciplinary training. So we've taken the OT and cross-trained them with speech, and speech is cross-trained with OT. And then we have psychology cross-trained with speech and OT. And then they also had pediatrics involved as well, as is true of the original Morris Center, was built by a developmental behavioral pediatrician. So the question is, can we use all these healthcare professionals with different realms of developmental expertise, increase the intensity, increase the frequency, and increase the immersion of those activities across any hour of intervention he's in. So as you were describing, more speech happening every day as much as possible,
Mhm.
and OT happening every day as much as possible. We won't do OT twice a week because all that does is decrease the chance you get effective rewiring and neuroplasticity happening. The brain
Right.
needs daily practice to build those skills. So just wanted to jump in and give kind of that bigger picture background for the viewers who are
Yeah, thank you
watching.
for the explanation, because
My,
I didn't realize, yes, that it was so complicated. I still don't realize how language happens, but his language is just improving every day. He's doing something new now, every single day. And
and say he's 11, right?
anyways,
He's now
yes.
11. Yeah.
Hmm.
And back then he was about, I think 9.
9,
So
yes.
from 9 to now we're at 11 years of age. He's at Morris Center. Tell me, what is his current daily routine at Morris Center in Ponte Vedra? How many hours of OT? How many hours of language? What do you think
So
is happening right now
it actually, when we started in November, he was slowly increased to about 3 hours of OT, 2 hours of speech, and he was doing great.
per day?
But per day.
Not per
Um,
week. Yeah, and we have to clarify
Not
because
per
some
day,
people.
not per week, per day.
So
And I
per-
remember when he was newly diagnosed, that's exactly what I used to ask his OTs were. I was like, stroke patients get 3 hours of therapy a day. Why can't you
Yes,
give it to him 3 hours a day? And they'd be like,
yes,
oh no, he won't be able to tolerate it.
not
But
true.
anyways,
Not true. Yeah. And
anyways,
if he
so
can't, and if he can't tolerate 3 hours a day, it's actually better to do 1 hour 5 days a week than to do
mhm,
3 hours twice a week. It'll be
right.
fewer hours. 5 hours a week with the daily versus twice a week for 6 hours. You'll get more progress with daily for 1 hour,
I
even though it's
agree.
actually in total fewer hours because the brain needs that daily stimulation to fire the neurons, and they're
Mhm.
starting to wire together and wire together more and wire together more. And that's that neuroscience piece of the neuroplasticity of brain learning. And you're right, in stroke rehab, which I'm also 10 years published in stroke rehab. And in my 10 years work in stroke rehab, it was, can we rebuild the sensory motor skills needed for phonological awareness, to then rebuild phonological awareness, to then rebuild letter sound knowledge. It sounds just like we're treating dyslexia. And essentially we were, but because it was due to brain damage, we called it phonological alexia. It's an acquired reading problem, but we had to follow the same developmental hierarchy. And if you're a patient in the hospital and you're a Medicare patient and you have a stroke, typically Medicare requires 6 days a week of therapies. They know
Mhm.
you'll make faster progress. They know you'll discharge sooner. But most
Yes.
outpatient clinics or small private practice clinics don't understand the extreme importance. And they worry that, well, our patients won't be able to afford it if we do 5 days a week. So, well, but if you do twice a week, you're going to draw something out to take like 3 to 5 years that might be
Mhm.
accomplished in 1 year of high
Exactly.
intensity.
Exactly. And it makes so much difference in the patients who go into inpatient rehab.
Yes.
And yes, back to Abid. So then you told us about starting him on more of different
Yes.
um,
The other interventions.
therapies. And
Yeah.
so he started a year later. He was to be evaluated by Dr. Denton. They met him, they evaluated him. He had improved. But we were told that they didn't have the facility to work with autistic kids. And
Mhm.
they were like, but if you guys go to Ponte Vedra, they can do that.
Right.
And Emma and I were like, okay, when can we move? I still remember it was March
Please.
13th. We came back from that meeting and we both put up our CV. Actually, he put up his first on the LinkedIn and Indeed. And we started looking for houses that same evening in
Wow.
Ponte Vedra. And I contacted a real estate agent to work on selling our house in Birmingham. Because
Wow.
it was like, yes, this is a place, because we saw the change in Abid in then 1 year in sensory
Mhm.
integration OT, and we
Mhm.
were willing to do whatever. And anyways, we moved in November. It's a tiring process. It's not easy on him.
Yeah.
Initially, he would come home and take like a 1 hour nap almost daily, but slowly he was able to tolerate more. And by May, he was actually getting 5 hours of therapy a day. So 3 hours of OT and 2 hours of language. He was
Right.
tolerating it from 8 to 2. May 11th, no, May 7th, he had the strep infection. with a
Yeah.
GI bug. And and after that, he suffered from PANDAS.
Hmm.
And so PANDAS is a horrible, prolonged thing. So we are still working on it. He
Hmm.
was treated, he is improving. Of course, it took a long time to get his strength back, which he's
Yes.
still coming back. He is still doing 3 hours at the Morris Center, 2 hours of
Hmm.
OT and 1 hour of language. And
Right.
even with all the recovery he's making, all the recovery he's going through, how much tired he is, there are times when he comes home and sleep for 2 hours. Initially, it was worse. I remember the very first day I brought him back from Atlanta after his initial treatment. He went to the Morris Center and he slept. So for like 3 hours there. But the staff is just wonderful and he is improving. And a couple of days ago, Abid never says anything unless you ask him. A couple of days
Right.
ago, there was a balloon and he looked at it and he said, "Balloon."
Wow.
And I was just so happy. The fact that he paid attention, the
Hmm.
fact that he said it, the fact that he was like able to say it. I mean, this is a kid who would, even if you ask him like 5 times, he might answer you once.
Right.
And he's actually, every day you will see him saying something different, something new. And he has a judgment now. Like
Hmm.
you can't force anything on him. So he might not say yes or no that clearly all the time, which they're still working on. But if you ask him, do you want to go eat ice cream or go home? And he can tell you, I want to go home if he doesn't want to eat ice cream. You
Right.
can't force. And that's the best part. I'm getting to know what he likes, what he dislikes. I never thought I'll be here. Like Abid will get that far that fast in since November even.
Because he can now share it with you. And so to back up and say, okay, so what's happened? So we're still doing OT. We're still
Hmm.
working through this sensory pyramid. And
Yes.
I'll put this up on the screen. This is the sensory pyramid we're working through, which is at the bottom are those 8 sensory systems. It's the 5 everyone learns in
Mhm.
elementary science class: see, hear, touch, taste, smell. But OTs know there's 3
Mhm.
more critical ones. It's vestibular, which is balance. It's proprioception, which is body awareness, and it's interoception. It's your internal awareness of your energy level, your mood level, your hunger level, your toileting. It's all those internal receptors, and we want those 8 working together. And I know it's hard to see this for folks who are viewing, but it goes up from basic attention, sensory modulation, regulation. At the very top, now we get language skills and interpersonal skills and executive functions. And that's the pyramid that OTs keep working on to keep building those skills up. But we're also doing 1 hour a day now of something that when we tested him in 2023, we said he's not ready because he didn't have enough ability to focus, enough ability to engage in a language approach. It's a developmental language approach called Now Foundations. And it's developmental because it goes now foundations for speech, language, reading, and spelling. So now he's learning to wire all the sensory systems that build perception of sounds and words, productions of sounds and words, which means you're beginning to build that ability to store words by sound and be able to retrieve words by sound. So it's spoken language we're working on first. Even though all this work he's doing in the language therapies is aiming to get to reading and spelling, in most every language in the world, you speak it first and you read and spell it later. And so we're building that speech language processor first, and OT knows what they're working on to help support it as well. They're improving visual perceptual, visual memory skills. They're improving oral motor control, oral motor perception, oral motor precision. And then the language team is using that to really build that better phonological processing. And he's now getting to the point where he can take 2 sounds and blend them together. And
Mhm.
Aisha, that's the act of reading. Even though he's not looking at letters, just the act of taking 2 sounds, putting them together, that is the core feature of what we call reading or decoding. He's also working on the opposite, which is he hears a word, somebody says to him, his brain has to take it and split it apart and break the word down into 2 sounds or 1 sound or 3 sounds. That's the act of spelling. You take a chunk of sounds that we call a word and you have to be able to split it apart. So again, we're doing it without letters right now. It's very concrete, very sensory driven, but that's also building that speech processor for input systems of words, the store, and also the retrieval part of words. So that when he looks at balloon, he could find the word he's thinking of that he's heard people say before, and he can actually organize the mouth to say that word that his brain has retrieved. And it sounds pretty simple, but it's extremely complicated. It's actually more complicated than rocket science, because we know rocket science. We know how to put rockets up into orbit, but changing the speech processor, there's still parts of it we don't know. But he's building that with OT each day. He's building it with that now foundations program each day. And let me throw up a question that one of our viewers is asking. This is Trey, and he's asking, does now programs improve working memory and picture vocabulary? Let me clarify the question first. Working memory is a broad category. There's visual working memory, there's auditory working memory, there's actually sensory motor working memory systems, how you coordinate a bunch of movements to do an activity. So there's multiple working memory systems. OT works on the visual working memory. Some people call it the visual sketch pad. You can hold an object in head and rotate it, manipulate it, and do things to it. The language team works on the auditory working memory. Can you hold on to sounds, perceive sounds, judge, order, change, difference of sounds? Also then gets the words. Again, then gets the concepts like semantics. And so these are pieces that the whole team is working on, but not with just one program, Trey. It's part OT. It's part the language interventions they're doing. And then your other questions about picture vocabulary. That is, can you recognize the object? Can you retrieve the word that goes with that object? And can you get the mouth to actually say it? Aisha, what you've mentioned, which is a great analogy, is what we know from stroke is when adults have strokes, they know the word they want to say many times. They have what we call a Broca's aphasia, but they can't get the mouth to move the way they want it to move to say things. And when we do rehabilitation and change their speaking skills, they'll tell us, every time my wife asked me what I wanted to drink, I knew I wanted to say tea, but the word milk came out of my mouth. But in my brain, I was thinking tea, but my mouth said milk. And you'd see it on the adult's face. They'd be like, huh. And then one day, and this happened with one of our patients, and his wife was so excited. She said, honey, what do you want to drink for dinner? And he said, tea. And they both looked at each other because he actually said what was in the brain came out the mouth. And it just took hundreds of hours of work to rebuild that storage, retrieval, and get it to the motor system as well. So you're right, extremely complicated systems. There's a lot we do know about, and there's some that we don't know about. So Trey, great question. It's a part of the whole process we're trying to work on, but it's not one program, because now programs has 4 programs. The one that Abid's working on right now is just that phonological processing from the spoken level and the speech level first. Later we'll get to letters, but we're not even there yet. And we are now starting to see words are starting to come out. And that's the goal.
And one thing, 2 days ago was the first time I asked Abid, what did you eat? And he actually answered me. He said spaghetti.
Fabulous.
He would not answer that question.
And yeah, most people don't know how huge of an accomplishment that is. Because now the gate is open.
And I know it sounds like really movies and pay attention.
Yes.
He wasn't able to do that before. He would only listen to songs. But now I put on a Disney movie. He loves Rapunzel, Tangled, and he loves the Atlantis. He actually follows the movie he's supposed to love and gets scared where he's supposed to get scared.
So then he's understanding it now. He's perceiving the emotion. He's perceiving the content, the meaning. And that's exactly what the goal of what the team is. Unlock the visual system, strengthen visual's connection to semantics, which is mostly back over here. Strengthen visual semantics also to where you actually can push the pieces back and you begin to build that functional language skills. And we're working on 2 language skills right now. It's expressive, spoken language skills, and it's receptive, the input language skills. For him to actually be able to answer your question, he has to be able to hold on, understand, and perceive what you said and what does that mean. Then he has to formulate the answer, find the words, activate the words, get the motor programs up here in Broca's area to move the mouth to say the word that he has in his mind. And it's extremely complicated. But as it starts to build and it starts to wire, and we're now seeing a small glimmer that it's building, then the floodgates should start getting opening and it should start seeing the skill get stronger and stronger. So we keep high intensity, high frequency, and then we keep raising the developmental bar over time.
Right. No, I'm just so amazed at how this language works. I never thought it was so complicated because you never think about it. until
Yes.
I saw one of the Abid's session. The psychologist showed it to me, like a video of what he was doing, and I was like,
Yeah,
"Wow, you guys take it from the very basics about how a baby learns."
exactly. Yeah, so both of the core programs at the Morris Center come from people way larger than my expertise and decades ahead of me. So the core development of the model the Morris Center uses was built by a developmental behavioral pediatrician who not only did a residency in developmental behavioral peds, but Aisha, she did 3 other residencies: child
Wow.
psychiatry, child psychology, child neurology. And you might ask, why would someone do 4 residencies? Well, her husband was in a pediatric heart surgery residency, which is going to take 6 years. So she wasn't leaving Duke anytime soon. She's like, I might as well keep training. So thankfully,
That
we
was
all
amazing.
she kept training. So she built the model of how we cross train the speech with the OT, with the psych, and the medical all together.
Mhm.
And then Patricia Lindemuth was a speech pathologist who understood that language is a sensory motor system first. And then it becomes a spoken language system later. And so, yes, she studied how do children build spoken language output and spoken language input systems, and how does that build a foundation for better reading and spelling skills. And when she studied it from the developmental models of kids who don't struggle, then she took that developmental knowledge and looked at kids who were struggling, and whether it was autism or whether it was a developmental language disorder or whether it was dyslexia, trying to figure out where in that developmental hierarchy is there some inefficiency or some difficulty in processing. And that's what she began to build her original program. Aisha, she wrote it in 1969. It was called Auditory Discrimination in Depth. And I myself personally am a beneficiary of that program. So I got that program when I was 5 years old because dyslexia doesn't run in my family, it gallops. It's brother, sister, father, nieces, nephews, aunts, uncles, and all through many levels of our family, we have the genes for dyslexia. But because of that developmental intervention that we all got at early ages, none of us have struggled. We don't struggle to read and spell. We didn't need special ed. We didn't need accommodations. And it's because of doing exactly what you said, which is understanding the typical developmental model and then applying it to how can we actually help a child who has any type of developmental difficulty, whether it's autism or developmental language disorder or dyslexia or dysgraphia or dyspraxia, any of the what we call neurodevelopmental disorders. How do we take the weaker skills and make them stronger? And I must make
Mhm.
one really important comment here. Many families get very off put by what I just said. They said, my child is not broken and you don't need to fix him. Like, well, every parent has the choice of, do you want to help your child progress and build more skills? And
Right.
if you don't want to build your child more skills, that's perfectly fine. That is your choice. But if you do want to help your child build more skills and build more independence and have more opportunities and more ability to communicate, more ability to connect with the world, more ability to study academically, then we want to have the ability to offer those services. So it's always back to the parent's choice. But understand the goal is, how do you help the child have the most chances to have the most productive and joy of life?
I'm just wondering, since the study is that old, why aren't the speech therapists trained on that?
It's a challenge in that speech therapy is a huge profession. So I used to lecture to grad students in speech
Like, I
pathology.
wish I knew about this program when Abid was like 3 or 4.
Yeah, earlier. But the
Mm-hmm.
speech therapy training is a very broad discipline first. They learn spoken issues, they learn swallow issues, they learn breathing issues. They study um, eating issues, they study language issues. There's a whole wide array. And then some speech therapists go focus on adult disorders. Some go
Mm-hmm.
focus on pediatric and only autism. Some focus on pediatric and only dyslexia. Some are generalists, they're broad practitioners. So the graduate degree of speech therapy, identical to the graduate degree of OT and identical to the graduate degree of neuropsychology, does not prepare you for the expertise in the actual treatment of a specialty area. It gives you a broad background. And then most people must then choose to specialize and seek additional training. So for the OTs at the Morris Center in Ponte Vedra Beach, we will
Mm-hmm.
spend thousands of dollars for each OT to complete sensory integration certified training courses through the University of Southern California in Los Angeles, because they are the home university for the core theory of sensory integration as a developmental model for sensory motor processing. We'll spend hundreds of hours training the speech therapists in that Now Foundations program. So we invest heavily to take their generalist training and now make them advanced experts in these developmental programs, and then cross-train them, bring them together. But it is, you're right, it doesn't happen right out of grad school. And even more complicated is most grad school speech clinics and most grad school OT clinics and even psych clinics do not do daily intervention. They'll do it twice a week for 30 minutes. And usually that's more of a financial reason, not because that's what's best practices for patient and patient progress. Here's the accountant, or what we call the financial model of that issue. If you have a patient scheduled for 2 30-minute sessions and they get the flu, you only risked 1 hour of revenue. You didn't have a big risk. But if you schedule a patient for 5 hours of therapy, Monday, Tuesday, Wednesday, you've risked 5 hours of revenue. And if you do that across all of your patients, your odds are you're going to have lower volume of patient hours per week because people are going to be sick and you won't be able to fill those slots. So you won't make maximum revenue. So that's mainly the main reasons why university clinics don't practice high intensity, high frequency intervention. It's more of the financial side of keeping the clinic in the black, as opposed to what's the best quality of care for the patient. And so that's why you would not know about it early on. And that's why you wouldn't even know that you could do OT 5 days a week. And you might struggle to convince some OT or some speech to do daily intervention.
Even when you recommended that Abid received 5 hours of OT, it was literally pulling teeth. Just like pulling teeth to convince the speech therapist to do the 3 hours a week, because she was like, it's not a university-based program. That was a private practice. If you miss a session, you pay. Right. But they are just believing that you should not overwhelm the kid with that much speech therapy, which never made any sense to me.
Well, but it will if they actually, what they're doing is too high level. So like you understood, we're doing stuff at very low sensory levels, sensory motor levels. It's the core foundation that we understand is the lowest level of sensory motor processing to build motor skills, regulation of mood and attention, focus skills, to build the early speaking skills. We're going to the very lowest level. And so then you can actually systematically not overtax the system. But if you go straight into word activities, you go straight into reading activities, you're putting activities up here, but the brain's processors are down here. And in that situation, they're right. You will overwhelm the child because you're asking them to do things that are too high level and are too difficult, and they just don't have the skills yet. So they're going to get frustrated, and they're not going to make as much progress, and they're going to fatigue, and they're going to feel bad about coming to the sessions because they know I'm not making much progress. So it's a very different approach between a developmental model and just kind of a traditional model of speech or OT. Is we just do a little bit of what we think might help today. Let's do a little bit of what we think might help tomorrow. And it's not as well structured developmentally, and it's not integrated across disciplines. That makes it harder as well.
I understand. And that's why I'm so happy we found out about your program, because Abid was doing well in a traditional speech, but the change here is just phenomenal. I mean, the fact that he's paying attention and is motivated enough to say something about it, it's just beyond words. Like I can't explain how happy it makes me, how surprised it makes me. Like, wow, you knew this, and this is the first time you're saying it.
Right.
Like, and the words are coming out. If I had showed him balloon in the past and I'd be like, what is this? He'd be like, balloon. But now the fact that he looked at the balloon and said balloon, it's like, when a little kid says, oh, light, they're sharing the thing. It's shared attention, which is a very basic skill.
Yeah. And that's part of changing some of those weaker skills in autism, which is it now begins to change the social communication difficulties because now you're communicating. Now you're able to share what you're thinking, share what you recognize, share what you see, and they're better able to start to build a conversation and build engagement.
And I don't know what changes also, like how it works. Like, I know you explained it very well, but still I don't know what changes what. But Abid's eye contact has also improved.
Right.
Like, I knew someone who saw him in November when we moved here, And they were here just past week when Abid was still sick.
Mhm.
And Abid, and they were like, wow, he's looking at me when he's talking to me now.
Nice. And that's another system the OTs are working on. The
Speaking
OTs are
louder.
working on
Before he
that
would just
visual tracking system. Oh, sorry, Aisha, you froze for just a minute. Go right ahead.
Oh, I'm saying, like, now he has the confidence to talk as well. Like, he speaks louder. Before, he would just mumble.
Right. That's just fabulous because he knows what he wants to say and he has better
Exactly.
voice and intent to say it.
Exactly.
Nice. And
It's
so
an amazing program.
and as the real joy too is to see that outsiders who've been away and come back, 4 months later, 6 months later, they themselves can notice the change. Because if we have to tell you he's changed and we have to try to show you some data that says that, see, this score got bigger, he's changed. If you actually can't see it physically in just his daily function, his daily interaction, then it really isn't changed. It has to be a functional level that mom and dad or aunt and uncle or friend who came by 5 months ago who comes by again, they then can see it. Then we've got real functional change. And that's the exciting part about autism. Nobody has a silver bullet for autism. Nobody even knows exactly what's happening in the brain wiring. We know far less about autism than we know about dyslexia. But we do know neuroplasticity still exists in the brain of someone who has autism. The brain can make new wiring, which is new learning. The challenge comes to the professionals. And I very humbly tell parents the number one factor that holds Abid back from making progress is how much we don't know yet. We're better today than we were 10 years ago. But if we knew today if we knew 10 years ago what we knew today, we could have made more progress 10 years ago because the child with autism then was still the same as the child now, but we didn't know as much. We didn't know as much about sensory OT, so we didn't do as much 10 years ago. But now the child's making more progress, not because autism is different today, but because the professionals who are developmentally trained and they're transdisciplinary trained across speech, OT, and psych have better expertise and better knowledge of what to do, how to do it, when to do it, with what intensity, what frequency. And so that's the goal of how we continue to keep unlocking part of Abid's sensory motor skills, the visual skills, all those pieces together. Let me throw another question up and comment from Trey. Trey says he knows that if I gave him 5 numbers and asked him to repeat them back in the same order, he wouldn't be able to do it. And let me explain to you, Trey, what that is. That is a auditory processing of language. So it's a speech processing task to hold on to 5 numbers. And speech processing comes down to the phonemes, the speech sounds. So a common difficulty in somebody who has a phonological awareness weakness or a dyslexia as well is they're going to struggle to hold words in head, hold them in number, hold them in order, and they're going to mix them up. Whether it's numbers, whether it's a street address, even whether it's sounds in a word, they might look at was and say saw. It's not a visual problem. They're not recognizing that when you say was and the first letter is an S, your mouth is not matching the letters. So you've now flipped or switched or changed the order of letters and sounds. So it's common that anybody who has a weaker phonological processor is going to mix up numbers, mix up phone numbers, mix up street addresses. But if we go in and rewire the speech processor first at the single sound level, and then we go to pairs of sounds, then we go to try parts of sounds, and then we build judging 5 changes in sounds. Can you tell when we add a sound? Can you tell when we take one away? Can you tell when we repeat a sound twice? Can you tell when we reverse 2 sounds? And can you tell when we substitute one sound in place of another? We're now changing your speech processor's ability to judge the mistakes that you could make in speaking or in reading or in spelling. But we're training at the speech level first. So then that's difficulty you have with holding numbers in head and holding numbers in order starts to get less difficult until you actually now can hold 5, 7, or maybe even more of these words and sounds or numbers together. So it's completely remediable from a treatment perspective, and it's completely preventable from an early intervention perspective, which is what you were saying, Aisha. Why do we know about this when he was 2? Because we could have done more intensive work from a developmental hierarchy, which is why we're doing this podcast. And we're so thankful to have your knowledge as a physician and as someone who understands as a parent what's happening.
Just to let you know, we physicians are not taught that much about this area. Like, I didn't even know anything about sensory integration OT. It's all what I learned from autism and from you.
Yeah. Well, but you understand the
Like
brain is an
all
organ, yeah, that has processing skills. You understand there's a science
all I
behind it.
knew OT was upper body until like Abid did sensory integration, and I was like, wow, OT
Yes.
is all that?
Yeah, a lot. Most people don't quite understand that OT is also a broad field, but can be specialized in developmental approaches to all those 8 sensory systems and how you
Yeah.
improve the input of the 8 systems, you improve the connection between the systems, and then those systems help us build higher level skills. Most people don't understand that phonics programs for reading just go straight to letters and sounds, but that's not where reading starts. Reading starts with spoken language skills, which has nothing to do with letters. And so phonics
Right.
programs are only going to help a little bit of the language system because everyone talks about how many learning disabilities are language-based learning difficulties. And if it's a
Mm-hmm.
language-based learning difficulty, then it comes back to being a sensory motor-based learning difficulty because language is sensory motor. Language is part visual. Baby watches, you speak. We know from a
Right.
laser eye tracking study, Aisha, that at 8 months of age, about 70% of babies are watching mom and dad's lips move. 8
Mm-hmm.
months. Most babies don't speak until a year old. But for the
Right.
8 months to 12 months, they're watching your lips and they start to babble more. They start to try to do what they see you doing. So it's part visual, but it's also part oral tactile, which is touch of the teeth and lips, and oral kinesthetic, how you move them, because they're trying to get their mouth to do what they see your mouth do. And then the acoustic, they hear what you're saying too. And that's why parents get down in their
Mm-hmm.
face of their child and they go, say, ma. And dad's like, no, say, dad. And they don't know why are they mooking their mouth so big? Why are they moving their mouth so big? It's because you're trying to
Uh-huh.
teach the child all the parts of the mouth, how to move them, where to move them. And that begins to build that speech processor, which is a sensory
Mhm.
motor system.
Right. And that's what Abid is doing now, looking at the pictures and putting the words
Yes.
together.
And so far, he has learned 31 of the 39 sounds that we need in our language from just the sound structure of language, all the vowel sounds, all the consonant sounds. And he's actually already now able to put 2 pictures of the mouth together to blend sounds. He's able
Mm-hmm.
to hear a word and figure out what was the first sound of the word, what was the second sound of the word. So he's able to split the word apart and figure out the number of sounds, the order of the sounds, and are they the same or the difference. And those pieces begin to really help build what he's doing and what he's working on. And that's laying the foundation for more language skills, more speaking skills to begin to grow, more comprehension and listening skills to begin to grow. And our goal too is we're going to teach him how to read again, even though it's amazing from your history. You knew that he showed reading skills about 18 months of age. He was picking
Mm-hmm.
up on words. What kind of reading was he doing around 18 months? He would look at picture books and tell them back to you?
He could read the registration plates.
Oh,
He
wow.
could read small words. My father-in-law only speaks Arabic, and Abid had great memory too. So there was this penguin book that Abid could read the beginning words, and he took it to his grandfather and showed it to him. And my father-in-law doesn't know how to speak English or how to read English, and he couldn't answer. So Abid just got so frustrated, he took the book away from him and like went to his dad. But
Interesting.
Abid knew how to read little letters and little words. But
Yeah.
what you're saying about putting the sounds together, I noticed that with Abid when I started teaching him how to read around the age of 3.
Mm-hmm.
He could tell me what a letter begin with, but he
Right.
couldn't tell me what the word begin with, but he
Right.
couldn't tell me what the word ended with.
Right.
So if I would make the sound, he would tell me what letter it is, but he could
Right.
not like look at the word or hear the word and tell me
Right.
what it's ending with.
And he has to be able to figure out what's the first sound and how do I move my mouth to make it? What's the second sound?
Right.
How do I move my mouth, teeth, tongue, lips, and air coming out to make the second sound? And then how do I put those together, which is really a very complicated motor sensory processing act. It's not
Right.
easy.
I never noticed that language was that difficult until I actually initially I was shown your pyramid, but then afterwards when I saw one of Abid's session.
Yes. Then you can see what he was working on and what he was doing.
Mm-hmm.
Yeah.
Yeah, I was like, that's really difficult.
Yeah. It's a lot of work, which is why he would be so tired when he got home. They're doing, let me explain to the viewers, because we said he's doing 3 hours a day right now. He had gotten up to 5,
Yes.
but after that infection that kind of set us back a little bit, we scaled back the work because his stamina had decreased. And when your stamina decreases, then your efficiency of learning is going to decrease. So we're going to slow a little bit down and build back up again. But when he's doing 3 sessions a day, it's 45 minutes of OT one-on-one. And then he takes a short 10-minute activity break out in the courtyard, walking, moving, something that's not directed. And then he comes back and does 45 minutes of the speech language intervention for that Now Foundations program. And he's going through several activities. Each activity lasts about 3 to 5 minutes. So it keeps his focus, keeps his engagement. It doesn't demand long. It's not 45 minutes on one activity. And then we take a 10-minute break again, go back, reset, refocus, get attention ready and he goes back to OT and does a second OT session. Later, we'll add a 4th hour and we'll add a second language session after that second OT session. That way we're going OT, language. And with the breaks in between, it's how we maximize his stamina, his engagement, his motivation, and his ability to get as much work done per session as possible.
Is how individualized it is. Like, with the constant meetings, constant feedback, they are always tweaking. And even I don't even have to wait for the weekly meeting. April or someone else always contact me. Hey, this is what Abid is doing. What do you think we need to do? Like yesterday, we figured out he gets hungry actually after the first OT session. So then they're like, you need to send 2 snacks because he's hungry. So, and today I sent 2 snacks and they said, oh yeah, he did better today.
Good.
So it's like
fuel.
Observing every little thing. It's amazing. And I think that's what makes the difference.
It's part of that power of what we call a transdisciplinary team with high intensity, high frequency. No matter what session he's in, OT knows what speech is doing, and OT knows how to reinforce what speech is doing. When he's in speech, they know what he's doing in OT and how to reinforce what he's doing in OT. So we've created an immersion model. But it's not like ABA where you're drilling a skill. We're not drilling any skills.
Exactly.
It's developmental, changing the processors. How is the brain processing fine motor skills of the fingers? How's the brain processing visual information to recognize it, to be able to store it, to be able to retrieve it in visual memory, visual perception? How's the brain able to put visual plus motor together in pencil and paper activities? There's all these different activities they're building, and they're building them developmentally, systematically, but they're reinforcing them throughout the whole day, whether he's there 3 hours a day, 4 or 5. And for some students, we can only start with 1. We start with only 1 hour of OT and build more focus, build more attention, build more sensory regulation and modulation. And then we can add a second session. The question the team has to decide with the parents is second session going to be now we're working on language skills? Or is it better to do a second session of OT and keep accelerating the growth in those sensory motor skills? So it's a fabulous challenge to the team. And I pretty much only hire people who love an endless challenge, because you have to be excited about figuring out this piece of the puzzle, figuring out the next step. But we do it from developmental science. It's not random guessing. It's very educated, very guided developmental decisions that the clinical team of speech, OT, and psychology are coordinating together.
Right. And they're doing a fabulous job at that.
Well, thank you, Aisha. So if you had something to share with families, knowing where you are today, and you've got a family who has a child who's 3 and with autism or 5 with autism, and they haven't found this type of a program, what would your suggestion be for them? How do the parents go about deciding why to make this choice?
Actually, Ahmed and I have been discussing it with our colleagues, whether here or in Birmingham, colleagues that we know whose kids have autism. Okay. And one of my close friends that I discussed it with, I told her son is about 2 years older than Abid. And I was like, when Abid was hitting his head, we were given the information, like everyone was telling us to put him on Lexapro or Topamax. And Ahmed was like, no way I'm going to start my kid on any medication. True. And what ABA was doing, they were always working on his behaviors. And I remember my husband always used to say, they are working on downstream things. Someone needs to work on upstream.
Yes.
And that's what I told my friend. I was like, the difference with Morris Center is they work on upstream. And it is not a fast process, but you see changes from the very first week. You see your child changing. It's like he is going through the developmental stages he should have gone through. Like now he's also throwing temper tantrums, but not a good thing. But again, I am seeing him developing. And I think that is how autism should be treated,
Yes.
with changing the development, like make them go through the same developmental stages like a neurotypical kid. I'm not saying that a neurodivergent kid is somehow problematic.
Right. Right.
But I mean, I love my son beyond life, but I do want him to have all the tools available for him to be able to succeed
Mhm.
as an individual and to be a productive adult. And for that, this program has helped. I feel like it's rewiring his brain, and it's an individualized approach. It's not a cookie cutter approach. And this is what I have told my friends, that with kids with autism, that especially some of them from Birmingham, because they're like, why are you moving? And I explained to them that this is why I moved. I even told two of them to move themselves. They think I'm crazy, but for me, the changes that I'm seeing in Abid is worth everything. Worth the move,
Fabulous.
worth the pressure, worth the issues, worth the horrible moving experience, everything. I'm seeing Abid growing now.
Mhm.
I'm seeing Abid coming out of his world. Abid is interacting.
I think that's really well said, Aisha. And one of our parents in the Morris Center in Trinidad brought us a boy at age 5 who had autism and had no speech. And within just a few months, he started giving words. And she had a really neat way to put this. She said, now that he's communicating with us, at age 5, I'm meeting my son for the first time. He now can
Exactly.
communicate. He now can share with me. He can,
Mhm.
as you said, he can express his preferences, what he does and does not want. And
Exactly.
begin to engage, and you're building a relationship with your child, which is a
Mhm.
really beautiful, powerful thing. And we want every child to have that opportunity to make that happen with their parents first, and then with the world as they go beyond.
Last month was the first time Abid showed me a toy that he wanted to get.
Wow. How did
It
he do
was,
that?
we were at CVS and we were looking at something, and he looked at the Spider-Man and he said, Spidey.
Ah,
And I'm like, do you want it? He goes like, yes. It was the very first time Abid had ever asked.
and he's now 11, right?
Yes. So you can
Okay.
imagine, I completely agree with her statement. It is the first time you're meeting your child.
Fabulous. Well, Aisha, thank you so much for taking the time to share this beautiful story. We're so grateful that
Thank you
you
so much
trusted
for
Morris
doing
Centers.
everything you do.
Well, it's for us, we feel it's a privilege to help because I've been that parent as well. My children all had learning disabilities, and thankfully we knew what to do to help them. But what about the parents who don't have the background we have or the expertise we have?
Mhm.
They're going to be randomly trying things, wasting thousands of dollars, and maybe putting their child in a vocational track or just a trade track or a non-degree track, thinking that's the best he can do or she can do. But what if they could do more? We're always trying to
Exactly.
push the envelope. So we appreciate the time on our success story. We're very thankful for the success. We'll have to revisit again later on and get a follow-up of where is Abid today.
Will
Thank you
do.
so
Thank you
much.
so much.
Thank
Thank
you
you.
everyone for joining us. We'll be back again in 2 weeks for another set of success stories of don't underestimate what the brain can do. Do not let anyone ever tell you there's a limit and your child has reached it. What that person is really saying is you've reached that professional's knowledge of expertise and their limit of knowledge. Go find somebody who knows more. You're free to talk to Morris Center. We do free consultations. You're free to talk to nowprograms.com. They do free consultations. Our goal is that we make sure all kids, teenagers, and even adults get the maximum progress to live the best joie de vivre or quality of life. Thanks again, Aisha.
Thank you
Have a
so much.
wonderful afternoon.